Hey, Dr. Lindsey and Wendy here. This fellow in the video that we're getting ready to do just walked in today for a refill of some Propecia, and I haven't seen him since August of 17.
It's almost 2 years.
And it's May of 19 when we did the second case. And he's an interesting character. I didn't even know he was coming, and I heard the door open. I'm back here doing computer work. And he's got a distinctive voice, and I said, that's that fellow from a particular state that's got an attractive wife. And sure enough, it was. And he came back in, and here's his picture before we got a hold of him. And we did a frontal U case on him. And then he came back a couple years later, and we worked on his tuft and a little bit behind it, and left him a good scar. And he walked in today and did this video. All right, hold that thing up a little higher. Okay. I'm here with Steve, who's covering his face because of, well, we can't really tell you. We had to edit that part out. But Steve is roughly my age, and we did a frontal U case on him, and I'll have his before pictures up between us right now. I don't know, what year? Keep that thing up in front of your face.
5 years.
5 years or so ago. And then, if you've seen some of my frontal U videos, the trouble is at some point down the road, that tuft goes away. And so he came back and we fixed his tuft and gave him a hairline that essentially is my hairline. And you look good. You came in today for a refill of Propecia, and you don't have any side effects. And man, you look awesome. Keep that thing up in front of your face. Have I been reasonably honest with you?
Absolutely. Couldn't be happy.
And what do you think any of these characters that are looking at this should hear from you, a customer that's been here twice?
Don't think twice about it. Stop ruminating and just go ahead and do it.
Well, thanks. And then keep that thing up. So I can edit this part out if you don't want me to say it. But so how old are you?
49.
You're 49. And so I'm 54, so you're a little bit younger than me. But I remember you, and we can edit this out if you don't want. I remember you because you came in, you got a bit of an accent, and you had a very attractive wife. And then when I saw you today, I said, I didn't even get to see you. I just heard your voice come in, and I said, that's that guy from a particular state that's got a good-looking wife, and you hollered in that you'd traded up. You're not the first guy that's gotten a hair transplant and traded up.
That's one of the side effects, right?
Yeah.
The benefits.
Okay. Well, we're not here to cause marital discord, but thanks for coming in today. I appreciate it.
No problem.
So what do you think?
He looks really good. He looks very natural. You know, when you said we left him a good scar, he was telling me that the girlfriend, not the wife anymore, the girlfriend was like touching his hair. He's like, oh my God, she's gonna feel the scar, and she didn't.
So I had him watch that video that we have where some of our patients' wives talk about they like to pull on their husband's hair during intimate times, which I thought, and this dude was like, that's exactly
yeah.
And he has not told her, and
but he said he will. I mean, he doesn't.
Yeah. So I don't know. I don't have any other words of wisdom to convey to you except so he's a pretty typical mid-40s, late 40s guy that has an increase in confidence that's helped him in the workplace and the social environment after his surgery. And
he's happy.
Yeah. So if we can help you, please give us a call. Thanks.